Everybody, this is Pat Hennessy here with Beere&Purves, and I wanted to thank you very much for joining us this morning. Hope everyone's having a good summer. The goal today is to really give you an opportunity to prepare for the Q3 and Q4 that's going to be here before you know it. We've got a lot of tools and a lot of resources available to help you, and so we wanted to make sure this busy season, give us a try, because I guarantee you will not be disappointed. We have increased staffing levels to really make sure this is a very stress-free as possible fourth quarter. What I want to do is let you know today, all the information you're going to see is actually going to be sent to you this evening, so you don't need to worry about taking feverish notes. These will all be provided to you. And if you do have any questions, please go ahead and send those to me. And if we do have time, I will be happy to go ahead and address them during the presentation. If not, I'll go ahead and send you an answer one-on-one, so that way you get your responses. Wanted to start off today by letting everybody know, for those of you that do drink coffee, there was a study done today that coffee consumers lead to a longer life. And people who drink 2 to 4 cups a day have an 18% lower risk of death compared with people who do not drink coffee, according to the study. And this was done today, and it basically covers Europeans as well as folks from all over the world. So I'm happy to say those of you that have a coffee habit, 2 to 4 cups a day, you now have just lowered your risk of death by 18% compared to those who don't drink coffee. So that's good news for those of us that do enjoy our coffee. So what we're going to do today is we're going to take you through our agenda. And the agenda today is really going through the fourth quarter checklist. And this is a guide that will really help you if you follow this step, and it's going to go month by month, how to make sure that you survive this process. Because as you know, 70% of the business will renew in the fourth quarter. And the problem with our industry is that it used to be spread out throughout the year, and now there's really nothing going on for the first half of the year, and it's all backloaded during the holidays. So what we try to do is get a jump on it, get a head start. Now's the time to start planning. So we're going to walk through that. We're going to take you through the medical updates for each carrier. And again, these are going to be for groups that are for 7-1, 8-1, and 9-1. The fourth quarter rates starting for 10-1 are going to be out here towards the end of the month. The next webinar will address all those changes. Ancillary update. What's happening now, a lot of the commissions for the existing plans, if a group has been in place for a long period of time with the same carrier, those are typically around 7%. As you move from your existing carrier 7% down to another carrier, it will go down to 5% for many carriers, and we want to make you aware of that. So obviously that is a reduction of income. So what a lot of brokers are doing now, how do you offset that reduction? One of the key ways of doing that is to look at ancillary and making that one of your behaviors of offering that on a regular basis to really offset the reduction in the income that you may be receiving going forward. In the past, we had significant rate increases. We're not seeing significant rate increases anymore. So it's really important for you to develop other revenue streams. One of them is going to be ancillary. There's others like workers' comp that are also available to you through this office. But please keep that in mind throughout this presentation, because those are things you want to build now to make sure that your revenue keeps maintaining that healthy flow to your offices. Legislation, what's happening now at a federal level and state level, we're going to review that, so that way you're up to speed on that. And then partner resources. These are the things that we want to make sure you're aware of. As you're evaluating your GA partners going into this fourth quarter, pick those that are going to provide you with the most resources, the most capacity, and the best service. And that's really where you need to be committing your business to, because you cannot afford to have anything hiccup during the stressful fourth quarter, and that's why we really appreciate being your partner. And we're going to go through why. So as we go through the next slide, this is your fourth quarter checklist. And so what you want to notice here is, what are you going to be doing in each month, January, July through December? You'll notice that the rates are going to be released, and United Healthcare already has their rates out. Kaiser has their rates out. What some brokers are doing strategically is actually doing their Kaiser renewals first. So they're actually taking their groups, and let's say you have 30 groups. Traditionally, 50% of the business will be Kaiser, so you take 15 of those. You do those renewals now, because oftentimes Kaiser will not change unless the owner wants to go to a non-Kaiser plan. And in that case, CalChoice would be a good option for you. But a lot of brokers are strategically doing and managing their Kaiser renewals first in anticipation and waiting for the non-Kaiser rates to be coming out. So you're going to be collecting the quoting information, the census information now. What some is they'll wait and want the renewal to match the census. And I would advise against that, because the renewals are going to be coming out, typically they're prepared 90 days in advance. The census changes. You have adds and deletes throughout that time period of that 3 months. So the current census is what you want to be working off of. You want to collect the current census. We can go ahead and match the current census to the plans that they're currently on, current and renewal, and then offer the various options that are going to be an apples-to-apples comparison. In August, the fourth quarter rates are going to be out. We can provide the quotes, the renewal versus comparison. And this is important for you as an office to determine what is your style. Some brokers really feel it's important to go ahead and have a very detailed quote with multiple pages to it. Others want it short and sweet. We would advise you to go ahead and keep it as simple as possible, because overwhelming somebody with a lot of pages doesn't do anybody any good. So current, renewal, cost comparison, like plans and a downgrade, and then the benefit summaries is what we're seeing works best. In September, now we start going into the, you're going to do the presentations. You're going to be scheduling these in advance, so that way you've got your meetings scheduled all throughout the month of September. The big things we're seeing blowing up now are provider and pharmacy searches. What's happening is, even though you may move from carrier A to carrier B, oftentimes the owner and the owner's family may be on a certain provider or is using certain medications. It's extremely important for you to make sure that you ask in advance, are there any medications or providers that the owner or the owner's family are using? And send those to us. We have personnel here that will actually go to the carrier's website, provide that analysis for you, do a screenshot right off of the carrier website that you're looking to migrate them to, and send that back to you. That way, if there's a problem, you've identified it in advance, and there's really no issues. We've had a broker lose a broker of record letter because they did not understand or understand that the medications and the doctor that they moved the group to, the carrier did not cover them, and it created a problem. So make sure that does not happen to you. The schedule the enrollment meetings. Again, 70% of the groups will be renewing in December. It is very important for you to get the scheduling done in advance. We have an enrollment team here. I can help with any new group enrollment meetings. We have interpreters, should you need it, Spanish, Mandarin. Let us know what is needed. We can have them available on site. Typically, the way the meeting goes is they can parrot the conversation. So if you split the group, you or I can assist with providing the English version, and the interpreter will go ahead and provide the language needed to make sure that that is a meaningful enrollment for everyone involved. And so please take advantage. That is a free service available to you. In October, then you'll start submitting the groups. And what's happening is some brokers now are really focusing on the online enrollment tool. We have eCentral, and there's a couple things I want to share with you about that. Some brokers are not giving their groups any option other than eCentral. It is a very comprehensive and speedy way of getting groups enrolled. And what we mean by that is we have a team here that will go ahead and set up the group. You'll basically provide the employer contribution. You'll provide, in addition to that, the plans that were sold. We can build that out within 24 to 48 hours. There is no cost to you for eCentral, by the way. For those of you that do own and have an eCentral subscription, we provide a reimbursement for you of $1.40 per head per month times 12. So in those cases where you're providing a monthly subscription, we will go ahead and reimburse you for that depending on the business we have with you. And we'll go into more detail in a moment. The beauty about eCentral is that there are no missing items. You cannot advance a screen without providing the information needed. At the end of the online enrollment, we hit a button. It will download all of the information into the employee application for the respective carrier, and you are all set. And then we electronically will send that over to the carrier for approval. This, during the busy season, is something you really want to consider adopting, because what it will do is prevent you from going back and forth with a series of missing items on 10 or 12 groups that you're all trying to gather at the same time. We found this to be very effective last year. We're finding that the take-up rate is very high, and we would encourage you, if you have not adopted eCentral, to give it serious consideration. And again, all the resources we have here are at no cost to basically get that set up for you. In November, it's important if all of a sudden the group, and I know So a lot of times it's out of your control. You're doing your best to get the group a head start. But now we start submitting. Anytime you submit it after 11:15, it's like being stuck in rush hour traffic. There is nothing you can do. You're going to be sitting at 5 o'clock and everybody is going to be trying to get out at the same time. So it's really important to have these conversations now with your groups that are coming in December, letting them know that you're trying to get them a head start so that way they can enjoy the holiday season. Because once you get behind and after 11:15, everything is going to be backed up. They will not be in the system by 12/1. They will not have access to their medications, and it's really going to create stress on you in that relationship with your employer. So once we have the groups approved in December, now it's time to do the audit. Oftentimes people take a break in December. This is the time where you have that month of December to catch anything that is incorrect. And again, the carriers are going full speed. Mistakes do get made. It's important for you to have that audit done in December. If there's somebody not on the bill, if there's something incorrect, let's fix it in December and make sure that it is correct. Then you'll cancel the prior coverage and then you'll schedule the administrative meeting and you're all set. So that is the process. If you follow this process, you will really save yourself a lot of stress during the fourth quarter. And again, we can help you in every step of that process. Now let's talk about the carriers. What do you need to know about the carriers? Well, what I'm going to do now is I'm going to switch to what is competitive here in the fourth quarter or in the third quarter. So what you're seeing on the screen ahead of you today is Alameda, Contra Costa County are the two in the upper left-hand corner. You'll notice these are based on platinum, gold, silver, bronze, and the HSAs. So for example, any groups that are renewing in 7-1, 8-1, or 9-1, when you're looking at Alameda, Contra Costa County, let's take Alameda first. It is going to be United, and it's going to be, if it's a gold silver plan, you're going to be looking at United Healthcare. They're the most competitive currently for the third quarter for the gold and silver plans. If you're going to be selling a bronze, you want to really consider looking at Aetna. For the HSAs, you'll see it's UHC and Aetna. Now, if you switch gears and you go to Contra Costa County, you'll notice that they have really, Anthem Blue Cross is really trying to make a name for itself in Contra Costa County. All the way from platinums, all the way through your golds, and even your HSAs, Anthem is the most competitive in Contra Costa County. So for your groups renewing 7-1, 8-1, 9-1, if they are not currently on the carrier that you see in front of you here, you may want to go ahead and look at it because there's an opportunity for them to save some money and put them on a more competitive plan. So now we'll go back. Now you know who's going to be most competitive as we go through this process. So Aetna, as we talked about under the plan offerings, they're going to have, you can only have 5 plans with Aetna. The top selling plan, as we just saw, is going to be that MC 6500 plan. So that's the one you want to be looking at. Under the renewal, the written confirmation must be received by renewal or termination for non-payment will be initiated. This is something that's new. We just want to make sure everyone is aware of that. Don't panic, but you want to make sure that you move, if you're going to move the group, let them know so that way they can go ahead and record it accordingly. You'll notice that the waivers under individual coverage on and off exchange is no longer valid. So it's going to be a little tougher to get groups through Aetna because their individual and exchange are no longer valid waivers, unlike other carriers we're going to talk about in just a minute. And most important is new business. So if you're going to write a bronze plan for 7-1, 8-1, or 9-1, and you submit it on August 2nd, you cannot have an Aetna plan because they will not take it. So it's really important for you to have groups submitted, and most importantly, this happens right at the end of the quarter. So for example, if you have a 9-1 group and you submit it on 9-2, Aetna says it has to be submitted by 9-1 or prior. They'll not take it. It's going to roll to 10-1. Unfortunately, 10-1 starts the Q4 rates, and the rates will go up. So now all of a sudden you've got an unhappy group. They can't have their effective date, and they're going to get a rate increase. So extremely important for you to manage the expectations with your groups. Let them know if you're going to go with Aetna, specifically that bronze plan, which is what we're selling a lot of, make sure that all the information is submitted prior to that effective date. Anthem. For those of you that are selling in Contra Costa County, Anthem is going to be your friend for the third quarter and into the fourth quarter. What's going to happen is the rates for fourth quarter are coming out on July 20th for Anthem. The rate increases we're seeing about 4.6%. What you want to know here is that the pharmacy, everyone is using the Select Pharmacy, And they are the only ones with a 5-tier pharmacy, and it's basically because of your generic is split in two. You have a 1A and 1B. If it's a very inexpensive drug, you're going to go to 1A. If it's more expensive, then you'll see it as a 1B, and that will vary by plan design. What's new is that they now have enhanced member technology. A lot of people are not aware of this. So if you do sell an Anthem group, you want to make sure you're able to explain the real-time maintenance for existing members to manage their accounts. This is brand new. It's one of the state-of-the-art features that Anthem offers. And if you need more information on this, please let me know. But it's something you need to be aware of and make known to your employees. Under networks, when you're quoting groups, you know that you can have the skinny and the full HMO, but you cannot have the skinny and the full PPO. So just be mindful of that. And again, when groups were coming from 50 and up, when it went from large to small, in the past, you did not have Palo Alto Medical in the HMO. Now you do. So all 7-1 small group HMO plans match the large group. We talk about underwriting, and what Anthem has done is some great things. For 6 or more, you don't need the DE9C, but you'll notice as long as you have that prior carrier bill, that is only until 9/15. So the underwriting rules may change for groups that are going on for 10-1 and beyond, but those rules are only through 9/15. Also, the participation has dropped significantly. We rarely see 30% participation, and that is also with Anthem. So if you have alongside Kaiser participation, maybe CalChoice doesn't work because the owner wants to have a platinum plan and the employees are going to go to a bronze, so you don't have that adjacent metallic tiers, then you can go to the Anthem and give them the richer plans and that are very competitive at the moment, but that is through 9/15. They're also adding some service components. So for larger groups, 25 or more, you get the welcome call. For 50 or more, you get the account manager. Now, the other thing that they're offering, and this is also brand new, so be mindful of this as well, they have what's called pay forward. So basically, it's a 15% cash back for 1,200 retailers. So this is also something when you're doing your enrollment meetings, please make sure that you're providing these benefits to the employees because oftentimes they're just simply not aware of them. The last thing there is in the group submissions, all new groups are submitted real time and we get a 1-day turnaround. And this is phenomenal because you submit a group at 9 a.m. in the morning, we will have individual ID numbers and a group number by close of business in most cases. So that is a nice thing that Anthem is now providing. As we move on to CalChoice, there's a couple things about CalChoice I wanted to point out to you. The fourth quarter rates, they're scheduled to come out 8/1. As you know, the EPO or the PPO, they still do not have a full PPO option. We were hoping that they'd have one by now, but not at the moment. The EPO utilizes the prudent buyer, and there's no PCP required. Why do we put this up there? We put this up because when we get to United Healthcare, they have an EPO and you have to pick a primary care doctor. So this is a little bit more, gives you more leeway. Also the Anthem Advantage. The way you want to remember the 3 networks within CalChoice, the EPO is the largest with prudent buyer. The Advantage is the middle tier, which has some Sutter facilities. And then you have the Select, which is the narrowest with no Sutter facilities. The Advantage has Palo Alto Medical Foundation. So what some brokers are doing is quoting the Advantage plan when a lot of the employees need to go to Palo Alto Medical Foundation and using that and saving the premium differential. So you want to keep these nuggets of information in mind to try to bring down the cost and possibly win some groups for some brokers that are not taking the advantage of these opportunities. Sutter and Western Health, this is big. You want to asterisk this one. Sutter Health and Western Health Advantage, Sutter Plus and Western Health Advantage, they have the same rates and benefits. What is happening now, and this is a bomb that got dropped the last couple of weeks, Western Health is losing UC Davis. Western Health Advantage, one of the key reasons they were picked up so much business in the Sacramento area was because of UC Davis. That relationship is going to go away in 2018. What that means is that if you write a group effective 8/1, typically you think that you're going to have that UC Davis relationship from 8/1/2017 to 8/1/2018. So that is not the case. Anything that happens as of January, any relationship with UC Davis is gone. So what brokers are doing is they're taking groups out of Western Health Advantage. They're moving them to CalChoice because sometimes you were written directly. and they're giving them the option of either going to Sutter Health, going to Kaiser, or other means of getting to UC Davis within the portfolio of CalChoice. This is something that it's viewed as a qualifying event, so the employees can move if they're currently within CalChoice to a different provider. So please be careful of this. This is gonna come to a head here very quickly. You want to get notification out to your groups that are currently on Western Health Advantage, either through CalChoice or directly, and you want to make them aware of their options. And again, if they're Western Health Direct, you want to be looking at CalChoice. If they're CalChoice with Western Health, you want to be looking at moving them to Sutter or some other provider within the CalChoice portfolio that accesses UC Davis. And if you need a list of those, please let me know. We can get those for you. Kaiser within CalChoice, as you know, is not an apples to apples plan. The Kaiser plans are richer and than the direct plans, and they're typically about 2% more. And the reason they are richer, the reason they're 2% more, is because the plans are richer. So that explains it's not an apples to apples comparison. A lot of people make that mistake of thinking, well, there's just a load associated with it. They are a little bit richer, so keep that one in mind. When you go to a base plan within CalChoice, we are seeing a lot of brokers use the Kaiser HSA 1350. It is one of the lowest deductibles available. It's very competitive, and it's something you want to consider when you're looking at CalChoice. Also, there have been some retroactive benefit changes, and if you need a list of those, let us know. Guarantee issue, we're talking about 5 or more, all you need is 1 week of payroll, which is extremely competitive. And then the DE9C, this is really helpful for those that have 10 or more enrolling. All you need to do is submit the prior carrier bill in lieu of the DE9C. And as we talked about before, the commissions are going down. The commissions are in place at 6.5% with California Choice, and that is one of the highest in the industry at the moment. There is talks that those could be going down here soon, so please keep that in mind also. HealthNet. HealthNet, as we saw, unfortunately, HealthNet has struggled, and unfortunately, it looks like the rate, the annual rates again. So your groups that are on HealthNet, you may want to take a look and see what options you have available. The value PPOs are in place. The other thing is with the new hires associated with HealthNet and Kaiser, you know that if you have a 12/1 effective date, and the employee is 39 years old at 12/1 when the group was incepted, and now we have a new hire, and that new hire now is hired in February, and now they're 40. The new hire premium is determined by the age of the employee's last renewal. So when that new hire comes on, if it's a HealthNet group or Kaiser group, you're going to give them a 39-year-old rate. You're not going to give them a 40-year-old rate as you would with the other carriers. It's extremely important that you do that because oftentimes we're setting up payroll and all this information is being deducted from the account. If it's wrong, it just creates an unfortunate situation that gets the HR people very upset. So we want to make sure you're aware of that with your HealthNet groups. Participation has gotten better. So again, 6 or more eligible. All you need is 35% through November, but it does exclude the PPO, Platinum and Silver plans. Moving on to UHC. UHC has been extremely competitive over the last 12 months, and they will continue to be competitive. So what you want to know now is this Navigate EPO, you'll notice that they do have a PCP required. So even though it's like a PPO, the employee, if they do pick that, will have to pick a primary care doctor. Under the direct plans, there's a lot of confusion when you sell a UHC plan. What does direct mean? Anytime you see a direct plan, it means if I go in for my elbow to be on an outpatient basis, I'm going to get a procedure done where I'm not spending the night in the hospital. If that facility I go to get that done is owned by a hospital, I will typically pay a higher fee. Typically, it's an additional $250. I could have gone to an independent facility and saved that money. So it's important for you to advise your employees and understand what's going on there. Direct means you will directly be punished if you go to an independent physician's, an independent outpatient service facility that is owned by a hospital. If you go to the UHC website, it will actually give you that information so you can know exactly which ones are independent and which ones are direct. Because of the cost to live in the state of California, a lot of employers are hiring out of state. So what we're seeing is more and more are leaving the state in order to go ahead and have lower costs of employees in different locations. UHC is going to be your friend in these type of situations, because if you have 51, or if you do not have 51% in California, they are the ones that have the most flexibility. If, for example, you have a group that has 6 employees in Nevada, 5 in California, we have the ability here in this office to get you a Nevada quote or any quote throughout the U.S. for UHC only if the home office is not in California. So please keep that in mind. If you do need that done, we can provide it for you. If it does sell, you as the broker would need to be licensed in that state to get paid. So that's all you need to be aware of. When you're looking at the quoting, you got Choice Simplified, which are the packages. You have Choice Simplified 1, 2, and Multi-Choice State. Please understand you cannot mix these plans across the packages. The packages are independent, and you can only select one of those 3, and then the plan designs within those. But one of the nice things we love about United Healthcare is their flexibility alongside of Kaiser. So we had a 90-life group. 85 employees went on to Kaiser Direct. The 5 managers wanted to go on to UHC because they were able to select a platinum plan. And as long as we have 5 employees in California enrolling onto a UHC plan, and the total between Kaiser and UHC together is at least 60%, we can write the group. So this is something that is very helpful in many situations, so keep that in mind. The DE9C also, this is a very helpful. The 10 plus, all you do is submit a participation certification form. You do not submit the DE9C. This is very helpful and makes underwriting very easy, so keep that in mind as well. The plan offerings, they're coming out with the Silver 2000. That plan is very competitive, so make sure you take a look at that. And then what's happening under new submissions, the submission turnaround time is now 2 to 3 days. And so we want to let you know that all of the carriers are doing a great job of getting the turnaround times faster and faster. Anthem's doing the best, and then UHC would be next because their turnaround times are getting just a couple of days. Now we're going to transition into ancillary. And the reason we're going to talk about ancillary is because, as we mentioned, the commissions on the medical are going down. How are we going to increase those revenue streams to your offices? We're going to sell ancillary, and now's the time to be looking at it. The Anthem plans, Anthem's got a number of options that are available to you. And when you look at the screen, they've got the child ortho available with 5 eligible, 5 enrolled. That is something that a lot of carriers do not have. We have a new GA portfolio within Anthem. As you come down, you'll see the integration with medical. You get one application, ID card, and bill. So that's the beauty of going with an Anthem dental plan. You also get the 5% discount. The underwriting, the DE9Cs are no longer needed for specialty only groups. So that's a real nice thing. And then the other thing is when you're looking at adding short-term disability and long-term disability to your quotes, Anthem has the ability of doing this 2 to 100. So if you're getting, if you have a request or if you want to look at adding more lines of coverage, you really want to look at short-term disability, long-term disability, ask us and we can get you those quotes as well. The other one we want to help you is with Choice Builder. And we have been fascinated with Choice Builder because they have become extremely competitive. In the past, the designs had been okay, but what they've done now is by increasing these ritual dental plans with a $2,500 maximum, by covering posterior fillings and a 90% UCR, those are available with Anthem and Met. We also have Anthem, Delta, Met, and VSP. These are premier carriers that are all bundled together under one umbrella under Choice Builder. And it covers implants. You get the Delta Premier Network. The underwriting is easy. There's no waiting period, even on virgin groups, and that's something that oftentimes we run into a problem with. So if you're looking for dental, vision, life, chiro, acu, and true open enrollment, give Choice Builder a try. Now we're going to transition into the legislation. Now, the nice thing about this is that we were extremely concerned here a month ago as to where this was going. On a federal level, we're still concerned because as of now, the information that we have is that the Senate introduced what's called the Better Care Reconciliation Act. So you want to make sure you understand anytime you see BCRA, That is the Senate's bill, and it's called the Better Care Reconciliation Act. So that's what that stands for. So what that did was basically piggybacked on the House's American Health Care Act. And what it did was they tried to get the Republicans to go ahead and vote for this. It looks like it's not getting where it needs to be to get the votes. So they're going to have to do a little bit more work on it. The key things with this plan, when you looked at what it's going to cost, it's going to save $321 billion, but it's going to increase the uninsured by 20 million over the next. So those are the things you want to. There's a struggle. That's why senators are not able to vote for it, because there's still a lot of problems here. They want to remove individual employer mandates. They don't want to tax the employer-employee premiums, and they're going to add the 3 years starting 2021. So what happens is ACA is still the law of the land. There's some, until something happens, do not pay attention. Well, pay attention, but be careful. Nothing is happening until this gets passed. So right now, this is just back and forth to try to figure out how to come up with something that everyone can agree with. So these are the other things that you want to be aware of at the federal level. At the state level, we were very concerned up until last month that this was going to be a possibility where a single payer could take over the state of California, and we could all lose our jobs. But what happened was, once this was submitted, Speaker Rendon, this doesn't make sense. It's going to remain with the Assembly Rules Committee until further notice. And what's happening is the problems were that the financing was so expensive. The delivery of care, the costs, control costs, are just, there's too monumental at the moment to make an informed and educated decision on this. So that has been shelved. Unfortunately, Speaker Rendon had received death threats by some of the union members because of the decision that was made that you see here today. So it's obviously a very passionate topic. You have not seen the end of this, and it will continue to surface in the future. The key points that you'll see here, Governor Brown expressed his skepticism as well. Now, Governor Brown will go ahead and be out next year, term out. So what we want to do is see the replacement. It could be Gavin Newsom. In that case, the plan will go ahead, or the discussions will continue. So now let's talk about the partner services. So as you're entering the fourth quarter, it's important for you to have a plan in place, a sales process. So as you're looking at all your renewals, how are you going to go ahead and manage them? What is the process? What can you offload to us to help with? What are you going to do yourself, and what's that flow going to look like? So what you can do, looking at this page here, this is the menu. So these are all of these services available. You can select some, all, or as many as you need, and incorporate these into your going into the fourth quarter. What were some of the brokers, we offload some of the quoting because of the volume of quotes. When we offload some, we're going to outline specific parameters. The quotes will come back. If it's a single-digit renewal, in most cases, we're going to renew it. If it's double-digit renewal or high, if it's double-digit, then we're going to go ahead and look at possibly moving the group. So there are parameters that are being set up, that are quoting reports that are being set up now to really make sure this process goes as smooth as possible. So you'll notice when your team is moving from A to B, the volume is going to be there. You're going to have folks out at enrollment meetings and those type of things, and those are the resources that we can provide for you. If you need help with an enrollment meeting, we do have a template here. It just tells what you're going to need: hard copy kits, worksheets, is it medical, dental. Once it's completed, we can either send all the materials to you or to the group, however you like, or bring them to the meeting. What we want to make sure is, now that again, as we mentioned, the revenues are going down, how can we help you improve your bottom line? One way of doing this is, if for those of you that have an essential subscription, if, for example, we sell a 30-life group with you, we will pay $1.40 per employee per month times 12. In that example, you would receive $540 to Essential to reduce your monthly subscription rate. In some cases, brokers have totally offset their subscription rate to Essential, which has been very helpful. So those are things that you want to be incorporating into your plan and we're happy to make sure that you understand how that process works and how you get those reimbursements. So how does that process work? Right now we have a team that will go ahead and set that up. What we have found is the best, from a best practices standpoint, is that the broker, you, and ourselves acting as the representatives of either the carrier or eCentral, and then the HR person at the group will have a conference call. This will be all set up in advance, and the HR person will actually walk through and enroll in real time into their benefits. So that way they can see what each screen looks like. We can add additional narratives onto the pages that as they go through, and then they will sign with their mouse and they are done. If there's any questions, we fix it at that time, and then we have the emails for everyone in the group, and they get sent to those employees. That employee that night will log in. They'll go ahead, change the ID and password to a secure site. They will start the process, go through it, sign with their mouse, and they are done. Every other day, we can send a report to you indicating who's enrolled, who hasn't, who started the process and hasn't completed it. At the end, when you say we're going to open it up on Monday, close it down on Friday. On Friday, if we haven't had anyone enroll, we can go ahead and extend that out to the following Monday. So that way you've got everyone enrolled and it's comprehensive. So please give that a try if you have not already done so. The other things we have available to you, anytime you have a group, if you don't need the online enrollment, if you have groups that need a POP plan, anytime there's premium only plans needed for groups 1 to 4, 5 to 19, or 20 and up, we will go ahead and pay for the first year annual fee for that. We will also pay for groups that are 20 to 100 anytime you need COBRA or anything associated with those. Here's a laundry list of things that we want to make sure we reimburse you for to really bring down your costs and increase your profitability. So now let's talk about some of the underwriting guidelines that are available. So when we go over here, and this is on our site, so let's say we have a situation where we need to, we know UHC is competitive, and we also know that Anthem's competitive. And what we've got a group that is, we want to see, let's learn about the DE9Cs, who requires the DE9C and who doesn't. So we would click the carrier, we click DE9Cs, and then we just come down here and we hit generate. So you'll notice here, this will tell you that for the DE9C it is required for Anthem, it's required for Shield, and it's required for UHC 1 to 9. And if it's 10 or more, the participation guidelines, all you need is the participation form for UHC, and it's not required for Shield. So what this is a very helpful generator that any underwriting question you have for any carrier on any topic can easily be loaded in here and then generated. Then if you want to save the results and send it, you can do that. If you want to edit the search, you just come back here. So if you have a situation with husband and wives only, husband and wife group, who writes that? Oops, select all, clear, there we go. Husband and wives, you'll click this, you'll just come down to here, you'll hit generate details, and you'll notice that none of these will write a husband and wife group. So this is really helpful when you're on the phone and you're getting pinned down with questions. Any question you have, and let's say we go back here, you'll edit your search. Now we're going to select all, and we're going to go here and select all. And now all of a sudden we're going to come down here. So now all the information's here, but now we want to talk who. We have a union group. Now what are the rules regarding union? So once we hit union, you'll notice that union falls under the carve-outs, and this is the information that's available to you. So now you know exactly who will take a union group and what those rules are. Very easy, very helpful, and this is something that will save you a lot of time. The other thing that we wanted to make mention to you is when you come under resources, everything is under broker, it's called backpack. You just click here. When you need a network comparison, we're just going to go under network comparisons, and we're looking at hospitals, we just click here, generate a hospital comparison. So we're going to look at Contra Costa in Alameda County, and we're going to look at the full MC network because we're trying to figure out who is in network with these carriers. So when you come down to Blue Shield, and then we come down to, here is UHC. Now you'll notice anybody in red is not in network. So when we're going to move a group to Alameda Hospital, we want to make sure that we go to the UHC Select Plus network. We do not want to put somebody who's an owner of a company into the Alameda Hospital, or move them to Shield if their child is being treated at Alameda Hospital. So this is a great tool. Anything you see in red that is not in network is to save you a lot of time. Here is Alameda County up top, Contra Costa County below, and this is a great search tool that you can use. And if you need the medical groups, if we're looking at Bay Area, we want to figure out who has certain medical facilities, and this is HMO. All we need to do is hit your Anthem, and here's Aetna, and here's UHC, and we're just going to hit compare. You'll notice if I need to make sure that somebody needs to go to Sutter, Brown, and Tolan, do not put them into that network. So this is a great tool that will help you save time and effort as you're going through this process. So we want you to stay connected. There's a number of ways of doing that. And as we finish up this presentation today, one of the things I wanted to share with you is why people are not getting the results that they want. And oftentimes it's people are not following up. And I know you follow up on a regular basis, but when we follow up, typically we use the same means. We're always following up using typically it's either a voice message or an email. There are a number of ways of following up, and some of the forms that brokers are using to get results, number one is the phone, and it's text. Oftentimes folks that are more text than others, and so having the ability to have that text information, oftentimes we're finding that the results are coming back faster, and the communication is done when maybe a phone call doesn't work or a voicemail is not working. A text is a very simple way, and that's the more preferred form of communication for some folks. So keep that in mind. Email, some people are sending videos, some people are sending links to other content, obviously personal visits and those type of things. So as we close today, I just want to let you know following up is going to be extremely important as you're entering this fourth quarter, and making sure that you do it. Varying your approach is going to lead to a better conclusion. Lastly, here is your team. So it is myself, if you need help with any new sales, any questions. It is Tracy or Heather, depending on, we have an office that is split, so that way we have more capacity available. They back each other up in the event of quotes or benefit questions, enrollment materials. These are your go-to people here. We have our underwriting team for new business processing. And again, our office is here in Walnut Creek, right off of Tree. We have our underwriting staff here. Ryan is the gentleman who will help set up your eCentral, so if you have that, let him know. If you need any questions, any special exceptions, you have a billing issue, a claim issue, and the carrier told you no, if it's a group that we have with you, please let us know. No is the opening negotiating position. We send it to Randy Halsey. He meets with these carriers at a senior management level every quarter, and oftentimes we're able to get the desired result. So please let that. Office, Jennifer Lasan, she's dealing with sales and strategy, and we also who does Ruben, who does any commission issues, Berlin, who does the bank over, even time you need POP plans in place, and Patrick Kim, if you need any help with workers' comp, quoting, strategizing, he's your person. So with that, we will close. If you have any questions, please let me know. These are the carriers we represent. The only carriers we do not have at the moment are Kaiser and Blue Shield. We're still in the negotiation talks with those carriers. So if you send us groups, we are thrilled to have the opportunity to work with you on the carriers here. Please use other GAs for the carriers that we cannot help with. And again, I think the service levels here, we've really done a tremendous effort to try to increase those to make sure your fourth quarter experience is as positive as possible. Thanks very much for your help. I'm going to go ahead and send you a copy of all the content we just reviewed today. And if there's any questions that you have at this time, you can please send them to me. Unfortunately, we are out of time at the moment. Email those to me and I'll get back to you. Thanks very much for your time. Have a great week. Bye-bye.